Hello and welcome to Kelly's Anesthesia Tips. Today is going to be a little bit of an experiment for me because I am trying to juggle updating my website to include some information, but I want to put the YouTube on it, so I'm going to have to do some back and forths. So bear with me, please. I think I can do this. Those of you who watched last year or are members of the Florida Anesthesia Administrators Association, the FAAA, will recall that in May of 2022, we shared information with our Florida organization and gave permission to share it. I'm putting it on here as well because this was brought to our attention by Dr. Frank Rosemeier, who is chair of economics of the Florida Society of Anesthesiologists and a past president. And we do try to work in conjunction with the FSA for things that are important to anesthesia practices or people who bill for anesthesia services in the state of Florida. So this was really something important that did not seem to get a lot of traction. Not sure why, but we are still trying to help practices understand what's going on with this. So today I'm going to do a couple of things. I've already gone on my website, which I will link all of this stuff. I just want to show you. Don't go to the YouTube link. You're going to go to the state societies and then offshoot to Florida Managed Care Medicaid. And that's where I am now, but I'm going to do it again just so you can see how to get there. And for the YouTube from last year, I haven't checked to see if this link works yet. So you should be able to cut and paste this. I'm going to try to get it to just link for you when I finish getting all of this together. This is like a moving puzzle piece, which is fun and interesting. So I'm okay with that. But if you did not watch it last year, this is kind of the background on what happened in May 2022, what Dr. Rosemeier said we could share, and then today is an update of this. I was fortunate that I was able to sit in on a call with Dr. Rosemeier and an FMA representative, Cynthia, who we have each other's contact information because I've offered to help in any way, shape, or form through our FAAA membership or whatever we can do to help each other. It's very important. So Dr. Rosemeier, through the FSA with Dr. Sell, who is the current FSA president, I'm going to share this stuff with you, sent a letter to all the Florida Managed Care Medicaid. So we're going to go take a look at two things. First, this is just a real quick reminder that I will put up this initial one that I shared last year. I'm going to put this up again, but I'm also going to do something else. I'm not going to give this. This was sent to all of our FAAA members, but since these are copies of the letter that Brent Sell, who is the current FSA, Florida Society of Anesthesiologists president, and it does mention Christopher Newland, who's their attorney, that gave permission last year for us to share these things. We're not sharing any non-published information. Florida Medicaid rates are published. They are known. This is not something, and we're not asking for any kind of dollar data from your practice, which might be a hint to whatever your conversion factors are. That's not important at all. What's important is that since December the 1st of 2020, Medicaid, the Florida Medicaid Managed Care plans, have been responsible for either meeting or exceeding the current Medicare rate, so it would have been of whatever that time frame was, for their patients who are, I'm going to say pediatric, so it's the patients who are up to the age of 21. So it'll say all of this directly in the memo itself. But anesthesia is one of the ones, and as I said, this goes all the way back to the one last year that I shared. Anesthesiology is one of the services. It does have to be in an inpatient hospital setting or an emergency room, so this does not count for your outpatient. but inpatient and emergency care, most of our patients are 21s or 22s or 24s, place of service codes. So these are things to keep in mind, but this is still a lot of payment that should have been received that hasn't been received. So they gave me permission to take these letters, and I've done a little bit of back leg work for you guys. I have now downloaded this file. I'm going to do it here just so you can see. You click on it, it goes to Florida Managed Care, but I have it ready to open for me anyway here. And what I've done is that I've compiled this information for you. I've done the contact information for Dr. Rosemeier. You don't need to send this stuff to me. I don't necessarily need to see it. I'm happy to help them with all of this. But this is his email address. This is the information that he's shared based on 38,000 claims based from December 2021 to current. And current, I think, for this was the end of February because the letters are written in March, if you notice that. So here it gives a breakdown of which of the different Medicaid managed care plans are paying incorrectly. And you'll notice that it is, for all of these, greater than 50% are not being paid correctly. So what I've done is I've taken each of the addresses for Aetna Better Health, AmeriHealth, I think that's Caritas, but I'll double check. I'm going to change it because I think that it is. South Florida Community, etc. I won't read all of these, but I did want to mention, if you are in Miami or Sunrise or Plantation or Tampa, because some of these places are out of state, but very few, most of them are nearby, I'm betting that, you could potentially go to these offices. I don't know if they allow visitors, but they might. I think if it were my money, I'd be, incentivized to make sure that I had my voice heard. So this is what I've done. I've given the addresses. I made a few editorial changes because when I write letters, I like to think that, or like them to sound like they come from me. So I write like I speak. So I took the template that Dr. Sell had and I made this an example. And then of course you should read this and put it in your voice or how you would write. You would also want to put your contact information and put it on your letterhead and send it by trackable mail to these addresses or hand deliver it if you can, if you're in the area and can just drop this off with a copy, or information regarding your claims that aren't paying correctly. This is a fairly simple report to run from your own systems. If you do your own billing, if you don't and you have a billing company, ask them, how do I get this data, or can you get this data for me? All right, I think that's all that I have for you. As I said, you can download this right now from my webpage. You cannot yet get the YouTube. I have to finish it up, wrap it up, and make sure that I'm able to get all of this stuff appropriately linked and opening, etc. So that's next, and I want to take care of it before the Easter weekend. So let me say Happy Easter to everyone. I hope that you all get to spend time with your loved ones. I also hope that if you have children, they still believe in the magic of the Easter Bunny and that you enjoy that. I'm going to be making a bunny cake with the ears and the coconut because that's my tradition with my kids and my grandkids. So, that's my plan. So finishing up with what I like to share, and I mean this truly, and I know that a lot of our anesthesia community follows this because I get people all the time that are sharing things that may help other people. So I still have a list of, YouTubes to get to. I try to do these as often as I can. Today this is important because I did want Dr. Rosemeier to know that the FAAA supports the FSA, our members support, and we want others to know about this as well. So I'll finish with, be kind to one another, generous with your knowledge. I thank you. When you subscribe, you do get the notifications as soon as these are published. And then I try to also share it on my published media. So you guys enjoy your weekend and see you next time.